Welcome, ladies and gentlemen. Another educational series of MSMA group, meeting number 6. As you all know, COVID-19 still a major health hazard in the world. According to the World Health Organization, 65 million people have been affected, and we lost 1.5 million in 138 countries. When you come to the United Kingdom, so far 1.6 million people have been affected, of which 60,000 people died. It's very, very concerning and depressing. The good side of it, brighter side of it, is the COVID vaccine has been accepted by UK government, and it has arrived to UK with all the speculations around. 40 million vaccines have been ordered for 20 million people. The first batch of 800,000 vaccines will be delivered next week, and it will be given to elderly people in care homes and also to the frontline healthcare workers. However, there's a somber warning from the World Health Organization. Please do not expect zero COVID after vaccine. So still you have to be careful, and you have to follow social distancing, washing your hands, and mask. Okay, let's look at the impact of this COVID on mental health. I think we dealt with so many things in the past 5 months or so, and this month we are going to concentrate on mental health. Mental health, mental injury to the frontline doctors, nurses, and other healthcare workers is very obvious. I have a first-hand experience, ladies and gentlemen. Our daughter worked in acute medical unit 4 months during the first lockdown period in East London. And I was living in a hell, but she came out all right. She's doing very well. We also see so many people with depression and stress due to the family of COVID deaths. Then shielded group, and some of us in our group, we are in the shielded group. We get depressed, staying at home, doing nothing, and a lot of depression in care homes and at workers. How do you manage this? Okay, so the best we can do is bringing the experts into the scene. So we invited 2 young, promising consultant psychiatrists from the tier 3 cities, Bradford and Sheffield. Dr. Elil Anand, consultant psychiatrist, is from Bradford, and Dr. Velusamy Sivakumar, consultant psychiatrist from Sheffield. Okay, over to you, Elil Anand and Sivakumar. Tell us the common problems, how we cope with that. Thank you.
Okay, thank you for your kind introduction. Can you all see my screen?
Not yet. Yes, we do.
Okay. Welcome everyone. My name is Elil Anand. I'm a consultant psychiatrist working in Bradford. We all talk more about the physical aspects of the COVID, but what is really hidden is a mental health problem. One estimate says that almost 1 in 4 people are affected by the effects of the mental health effects of the COVID. So what I'm going to do is I'm going to give you a very brief introduction to general aspects, and then we'll move on to especially the effects the COVID is on on the elderly people, mainly the social restrictions and the social distancing and how it's affected mentally. So now this is what I'm going to do, and also talk to you about basic myths about mental health as such, and then hopefully at the end we will have a few question and answer session. Okay, so what is mental health? I will give you a few seconds for you to think in your mind what this definition means. Also, do you want to put up your hand if you think you have had any mental health problem? I guess not many will.
I think we are old people, we all had. Take it granted.
Okay, but how many people will put up your hands and say, if I ask you, have you been anemic? Do you have diabetes? You wouldn't hesitate to say that. But if you have any sort of anxiety or depression, people would really hesitate. So what is the definition for a mental health? Mental health defined as a state of well-being where an individual realizes his or full ability and cope with the normal stress of life so that he can make a productive contribution to the society. So what is a mental health problem? You have so many definitions. Any mental health in your mind comes up, someone crazy. You have derogatory words like madness, lunatic. By the way, I don't know whether if people know why it's called lunatic. There has been some association noted between full moon and a mental health problem. So, when it is a full moon, you become crazy. I don't know how many people believe in that. So, so many misconceptions about mental health problem. Okay. So basically, mental health problem is something to do with your mentum, which is a brain. So what are the normal process of a brain? What does it do? It helps to think, perceive your emotions, your physical health, and your behaviors. So if there are any problems in thinking or problems in emotion or problems in sleep and other things, these are the symptoms of a mental health problem. Can you all point out where do you feel? If I ask you where do you think, you all say, this is your thinking part. So where do you feel? Can you point out where does the feelings arise from? I can see some of you pointing towards your heart, but I'll come to that in a minute. Okay, so this is where your feelings come from. So, don't be scared. It's not a real brain. Obviously, it's a replica. I just wanted to highlight, all the problems we have, so-called mental health problem, mind, everything is from this complex structure. Probably the most sophisticated computer we can ever have and we can ever decode. So the front part of the brain, which is where all your thinking is, where you think, and it's more sophisticated in the human beings, what we call the frontal part. And there is a midbrain and the hindbrain. But if you just dissect the brain, okay, so if you look into that, what we see is something called these bits are called limbic system. Certain parts of the brain,
a little bit higher up place, we can't see it. Yeah.
Okay. Inside a part of the brain is where your emotions are. So things like hippocampus, which is all to do with your memory, your emotions and feelings. They are all situation in your brain. Okay. So as we said, different aspects of the brain has different functions. And so if you look into an electron microscopy, so you see that now. Can you actually what's happening? Brain is a complex network of neurons which communicate billions of them, which every day as we speak, there is this transmission going on. And there are some chemical changes happening in the brain. You will all heard about dopamine, it's all commonly used nowadays. So these are the basic chemicals which is associated in various aspects. Okay, so how frequently is a mental health problem? 1 in 6 would have experienced some sort of a problem in the last week. And severe mental illness as well, about half a million adults in England suffer from it. So what do we know about mental health problem? So this is a functioning or an abnormal functioning of the brain. Okay, and it can be caused by stress, but stress alone cannot be the reason. What it is not. So people say, poor parenting. If it can cause later mental health problem. It's all depicted in the pictures and things like that. Obviously, early childhood experience and some untoward incidents can cause, but that alone it will not cause mental health problem. So what it is then? So it's a combination of genetics and environment, which leads to some sort of a dysfunction in the brain. So brain is seen as more like a plastic agent. Like you can it can be malleable in a way. So your early childhood experience creates some sort of a networking and some changes which can be altered. When I will come to that at the end. So many problems do start in childhood. If you see, some conditions are what we call developmental condition, ADHD, autism, or anxious. In fact, people do say that earlier childhood attachment, you can see certain characteristics persist towards adulthood. Studies have done, like even as a baby, how much you react can sometimes determine your what we call a personality. Some illness do start in adolescence, for example, schizophrenia, depression, social anxiety disorder, and addictions. So what are the different approaches? The biological approaches says some people with, for example, depression, you are predetermined. You might inherit some genes from your parents or from your family, and these are causing the problem. For example, low serotonin and low chemical levels, and that's why you take medications to do that. But real practice, does it happen? Normally, there is some sort of a social change happening. You see, always or most of the cases, you see a trigger. Something would have happened. You would have lost a job, or you would have had a divorce. You would have had a love failure, attachment problems, or whatever it is. Those things trigger off. And also, we also see not everyone who has this problem go on to develop a mental health problem. That's because there is a complex combination of biopsychosocial, we say. So there is this biological vulnerability, and there is also the psychological makeup and your environment. So briefly about depression. So when we all use the word, I'm depressed today, but what we call clinical depression is a group of symptoms, or what we call it's a heterogeneous group of symptoms which have been put together. If you have mild symptoms, it can be either mild, moderate, or severe. But the key thing is you have a persistent low mood. Just not today. I got up today. I don't feel bad in mood. You would have had a drink last night, and then you feel rough. So that's not depression. So you should have at least a week of low mood. You should have lost interest generally, and associated with that, you have poor sleep. You lack energy. You can't concentrate. You also have negative thoughts. You feel worthless. You feel inappropriately guilty about things which you do, and at times you also have thoughts about harming yourself or ending your life. So, as I said, again, so where does the problem lies? It all goes back to all your control in the brain. The input comes from outside, and all those sort of chemicals, which I will say in a minute. So what normally happens? Any stress happening, stress might be again subjective. So any stress happening, your brain processes it. The front part of the brain, it processes impulse. Then it goes on to what we call complex hypothalamus, and there is I'm sure you would have heard about hormones. Hormones are something which is secreted mainly under the control of what we call a pituitary gland, which is in the brain. And those hormones are secreted, and it acts on various parts of the body. That's why if you think, sometimes there is always an association between brain and the body. When you feel anxious, you feel like breathing fast. So what's the connection? And you feel like people have to open their bowels or go to the toilet more often. So these are all due to the hormonal changes and what we call the autonomic nervous system. So brain sends some signals to what we call the adrenal gland, and that again spreads to the various parts. Okay, and there is always a feedback mechanism which through the hypothalamus. So what happens? These have been proven in especially people with anxiety and depression to be deranged. For example, if you are an anxious person, the feedback mechanism is not working, or maybe you have a low what we call serotonin level, which might be contributing to the problem. Okay, so how do you treat depression? You can talk to someone. You can use medications, and there are other non alternative treatment. And again, I don't know whether if you know about ECT, you would have seen it in movies, or these things which used to be done in a barbaric way, where you pass electricity and then you have a fits. To be honest, ECT is one of the most effective treatment and can be life-saving for people with depression. So we have a stepped care model. So all depression, does all depression needs ECT? No. So some mild depression will be helped by psychoeducation. You talk to someone, and later on some sort of a formal psychotherapy. And only in the moderate to severe, medications are helpful. So what we call, I don't know if people would have heard about cognitive behavior therapy. That's one of the most talked about in the last few decades. Okay, so what do we do now? And if you take tablets, the main thing is, does that make you addicted? Many people don't want to take tablets because it makes you hooked on. Generally, we say for moderate to severe, continue at least for 6 months when you are well, and then we'll think about reducing it. There are safer medications at present, so we don't have to worry about it. And generally, any psychological interventions are known to prevent relapse. So if you continue with some psychological, studies have shown to reduce your risk of having a depression again. So, and generally you can follow your well-being. You can talk to a person when you feel how you feel. Exercise does have a big role in maintaining your mental health. Calming down techniques. People do try meditation, other things, learning a new skill, relating to people. Sometimes you help people. That itself can be a therapeutic. Contributing to others, or something being creative, or even congratulating others. Okay. So the next thing I wanted to talk about is generalized anxiety disorder. You would have seen someone, or you yourself, sometimes you feel worried. You don't know what's happening. Even the smallest thing, you feel something bad is going to happen. Your muscles ache. You can't concentrate. You feel irritable. You shout at your partner or your children. You can't sleep. You feel tired. You wouldn't have done anything. So why do some people develop anxiety disorder? Sometimes it can be isolated to genetics. Genetics is a very common thing. Maybe in future we'll all have gene therapy targeted at people. It's still in the early stages. Sometimes you would have had some early traumatic event, and your parenting style, how you would have reacted to something, and the way your parents reinforce your behavior might also cause you anxiety. Sometimes the society or the culture you are in, that might also cause you to have a problem. So some people, you would have heard about panic attack. Sometimes it's an acute period of anxiety. You feel stuck. You can't do anything. Okay, and you might have heard about the social anxiety disorder as well. Sometimes you feel very anxious in particular situations, especially in social situations. You blush, you sweat, you shake, you feel like being sick. And what do you normally do? So you avoid, you escape, and that itself can reinforce and maintain this behavior. Various treatment options. You can do self-help. You can talk to people, or you can have a formal psychotherapy, or sometimes there are medications. Unfortunately, some people do self-medicate by, for example, alcohol is a very commonly legal drug, which has been licensed by our society. Some people can be hooked on it. Okay. So now coming back to the topic which I wanted to briefly discuss, COVID and mental health. As we said earlier, it's a very hidden component, and studies have shown prevalence of depression has been really high in elderly, marginalization, and being social isolation. Almost people have been shielded for a year now. And in a way, you can even argue it's a human rights deprivation. Post-traumatic stress has improved. So I obviously, before any talk, you need to update your knowledge. So what do you do? Any scientific, you go into the journals, you look into what's been done. So these are the list of the journals I had a look, and these have been published over the last 6 months or so, looking at surveys, mainly surveys, looking at what's been affected. And overall, what they have found is self-isolating, social distancing females and younger age group are more affected, and especially if you have some physical comorbidity. And anxiety and depressive symptoms were really high during the initial periods of lockdown. And people with pre-existing anxiety problems had much more problems on post-traumatic stress. In fact, people are thinking about COVID stress syndrome, where someone will suffer. They have an extreme fear of dangerousness. You can't go out. For them, when you go out, they can only visualize the virus, coronavirus all over there, and they constantly worry about it. Sometimes it has even led to xenophobic fears, for example, a particular community or subculture causing these things to others. That might lead to social unrest as well, post-traumatic stress. And this leads to compulsively checking, hand washing. People, if you're more prone, people have become, like OCD symptoms have increased. Okay. So just before, I wanted to tell you, there are some myths about mental health problems. First of all, mental health problems, people think they are rare. I don't know how many people think they are rare. Put up your hands if you think they are rare. Okay. Well, I'll come to that. Do you know why psychiatry and mental health has got a very bad reputation? That's because certain treatments which have happened in the past have been really unscientific. For example, centuries ago, people didn't understand what they are. People used to make holes into the head to relieve as a part of treatment. Even now you see in some countries, people are being chained because of their violence. People are also put it into coma. People used to induce coma by giving insulin or some other means. So these sort of treatments have contributed to the bad reputation of psychiatry and mental health. So generally, as I said, it is a very common mental health problem. Is not uncommon. It is common, and almost 1 in 4 person will experience some mental health problem in a year. Okay, and the children and adults can also have problems. And the other myth people have is about the dangerousness. Do you think people with mental health problems are really dangerous? How many people think so? Research have shown they are not. In fact, the likelihood of person without mental health problem committing dangerous crimes is much more higher than a person with a mental health problem causing crimes. So these are the general things, and hopefully this will lead on to a further discussion, and probably we can have a few catch-up questions at the end. Obviously, thanks to Google, these slides are not mine. I need to acknowledge, we get nice pictures from Google nowadays, and also thank my librarian for providing me with the latest update. Thank you very much, and we'll now move on to our next speaker.
Okay, thank you, Elil. I thought you brought a real brain. That's very exciting. Right. Okay, we will invite Velusavi Sivakumar next.
Good morning all. Thank you, Mr. Raju. I'm just sharing my screen now.
Yeah, we can see it.
Okay, I'll go to the slideshow mode. Can you all see the slideshow mode?
Yeah.
Okay, thank you. Thanks, Elil, for touching on every aspect of psychiatry in a very short time. Actually, it's really good. And so I'm going to really stick to older people and COVID, actually. So I'm an old age psychiatrist in Sheffield. and I work in 3 different areas: the inpatient ward, community mental health team, and ECT clinic. So yeah, I mean, in the end, if anyone wants to ask any specific questions about any problems of older people's mental health, we can discuss. But my talk is going to be fairly brief, and it will only touch upon the effects of COVID in older people. So yeah, I mean, in terms of now my plan for today. So I'm going to first talk about the consequences of COVID on older people, and then in specific with dementia. And I'm going to touch upon the massive issues that has been very much highlighted about the care home residents and their families and their staff, more importantly. And also, I'm going to discuss about 2 cases fairly briefly, and I hope that that would give some insight into the kind of mental health problems that can be either directly related to COVID or simply a coincidental occurrence. Okay, so when we think about older people in COVID pandemic times, 3 things are quite well known again, and one is they are by the very nature that they're older people, the COVID affects them disproportionately compared to younger people, and their complications can be severe. And sadly, the mortality rate is high for them. So because of that, they, at least in the early stage, they were shielded and very strict. Sorry, I'm seeing lots of scribbles. Are you seeing anything like that?
Yeah, but
are the slides clear for you?
Well, there are scribbles, but we can read it, Shiva.
Okay.
Go ahead.
Now I'm just wondering why it's so actually. I can't really understand how it happened.
It's a design. Go ahead.
No, I'm seeing scribbles.
Yeah, the blue scribbles. It looks like a design, so you can carry on with your talk.
Okay. Yeah. So because of the high risk group of older people, they were shielded, and that caused lots of unintentional consequences. And the fact that they couldn't socialize, and so they had to miss lots of their routines, and the care and treatment they had problems to access. And the other thing is, because of that, compared to younger people, they couldn't easily utilize the remote means of either contacting socially or contacting healthcare professionals for their care and treatment. So having said all these things, there is also a risk of assuming that all older people are same. So we need to bear in mind that older people are not homogeneous group. There can be wide variations in their abilities, and also some of their resilience, and how they can have a better emotional control over things. So because of the fact that at the very beginning, when we didn't know much about the older people, how it would affect, and the fact that they were all shielded and they missed out, and they were told that they had to be all these complications like high mortality and severely affected situations, it caused a lot of anxiety, and so they started believing that they had to be shielding. And so what happened is they were getting affected by that kind of assumptions. And so they started assuming that they can't seek help even when they are unwell. So a lot of internalization of their beliefs, and so that led on to further distancing from the society. So there were few studies done across Europe and North America to find out whether it is really true that older people's mental health were disproportionately affected compared to younger people. So these are the early findings from a few studies, and so it really showed, it was really surprising to see that older people in fact showed significantly less anxiety, depression, and trauma-related stress, and also substance misuse or even suicide compared to younger people. This was, in a way, it was encouraging, and it really busted some of the myths we were assuming about the older people. But at the same time, we need to be cautious about these findings, because these are early findings, and the actual study may not represent across the spectrum of various different populations. So it is going to be really interesting to find out whether this type of older people doing better compared to younger people in terms of their mental health due to the pandemic remains to be seen. So future research is going to be really necessary, and also it will be interesting to find out whether it's true. Okay, so if we move on, so COVID, how is different in older people? That is in terms of how the COVID is different. Okay. The main thing is when people are in the old age, they tend to show the symptoms not typically. So lots of symptoms like either cough or fever or some of these typical symptoms which we all know in COVID, they may not show up in older people. And this is more so in very old people, and when they're frail, and when they have dementia and other various medical conditions. So this is an important factor, both in care home people as well as people who live in the community, for the families not to miss the COVID. So early testing is ideal, and the other thing is older people, due to various reasons, so if they are going through other physical health problems, or if they are mental health problems, sometimes they may either unintentionally ignore their symptoms, and or they may completely, I mean, they are reliant on other people to find out what is going on and to pick up the symptoms. So yeah, there are two things we get. One is typical symptoms are atypical, and the other thing is they may completely miss it themselves. So they rely on other people to find out whether they are getting the infection. So other thing is, few points specifically dementia. So again, one good thing is that, I mean, obviously dementia is in various severity. So starting from a very mild forgetfulness until the very late stage. But at the moment, there is no clear evidence to show that dementia per se cause anything like I mean, their COVID is severe, more severe than people with the non-dementia. I mean, when you control for age and other physical health, so dementia per se, there is no evidence to say that. But unfortunately, merely because of them being cognitively challenged, so when they are either not able to register what's going on, or when they are really forgetful, so whatever the safety measures that can be explained to them, they will struggle to follow that. And the other thing is, it may cause, so when they don't know what's going on, for example, when they can't go out, so previously they may have a very free routines of going for a walk or going out for their either meeting with their families or friends. Suddenly, if everything comes to abrupt halt, we can imagine what kind of impact that will have on them. So it will be more confusing and more frightening for them. And then if they have to be in a different setting because of either the dementia getting worse, or when they are physically unwell with COVID, then they are prone to get more acutely confused than their normal state, that we call in delirium. So that's either in the hospital or in the care home. If their routine is changed, then they are more prone for acute confusion state. So I think if you want to touch upon a few things, what we can really do to help people with dementia. Again, it all will come down to this one specific thing, like, what they miss out due to the pandemic and due to the lockdown, whatever, and all these things. So this massive change in their routines, and that is causing problems, and they can't access lots of remote means and things like that. But fortunately, some of the websites, like Alzheimer's website, there are lots of postings are there, like what they can really do, or what families can help their relatives with the dementia to keep them engaged within their own home, like other puzzles or various mental activities, or even physical activities, what they can do, simple home-based activities, which is really helpful if those websites can be accessed to find out. Right, the care home. I mean, this is like all these findings which I'm highlighting here is much early in the pandemic, which across the world, unfortunately, at that time, care homes suffered again very disproportionately compared to community and general hospital, because they were, I think, completely left in lurch. There were patients were discharged to care home without being tested, and they went and sadly spreaded the infections to other residents, because residents who live in their care home, it's their home, but then they may be, forced to stay in their own room because of infection. So it is very unfortunate situations. So it is not really surprising to see that this level of mortality, which was reported in across the country, so that 19 to 72% of the COVID deaths, it's 11 country reports from Canada to Australia, various European countries, and some Asian countries also. Again, as we said before, this can be easily missed because the symptoms are atypical and they're frail, and it's now it's better, I think. But when testings were so much difficult in the early part of the pandemic, that's when all these sad situations happened. And the other thing is now what kind of impact it's going to have on the care home staff, both at the present time, as well as both short and long-term effects on them, on their mental health. It is another important issue that will be, I'm sure, will be studied in depth by psychology and mental health teams. Are we okay for time? Just for another 5 minutes, hopefully, from me. Okay. Yeah. So just 2 case reports I'm going to highlight, actually, both which I have treated myself. So hopefully I have suitably sort of disguised that their identities can't be, revealed, basically. Okay, this is a gentleman who never had mental health problems. Okay, that's a more important aspect here. And he normally lives in one of the European countries. He's a British, but normally lives there, but he still has some residence here. So he just on his own came here beginning of the pandemic, just before the complete lockdown started. And then he got stuck here, basically. So he couldn't return to his family in that country in Europe. But he was a well-resourced man. Obviously, he traveled on his own here. He was doing that independently to come and look after any affairs in this country. So he was a forced isolation. So he was alone at home, just with some neighbors who was known people for him, just neighbors. So he became depressed. And it's a proper depression, not like what Elin was saying, just feeling down. It's a depression. He was neglecting himself. He was not eating, not sleeping, and panicking. Okay, he was contacting his partner in the midnight, not knowing what was going on. So obviously he lost weight very significantly. So he first went to medical ward, but unfortunately he didn't continue the treatment after going home. So he came to a psychiatric ward with severe depression. But then he also became psychotic. So again, if you remember, he had no previous episodes of anything. So he became deluded. He couldn't trust the food that was being served. He wouldn't take medications. So he thought they were contaminated by the virus. So he knew, okay, he even though he's 72, he didn't have any kind of memory problems. So he knew exactly what was going on in the world. But somehow he got into his mind that the virus was in the food and it will contaminate him. So he thought it's better not to eat, not to take medications. So he lost weight, and so he had to go again to hospital for IV fluids and tube feeding. So we had to start him on the ECT, which Elil talked about. Very scientific treatment, well modified, and nothing barbaric about these things. And it really made a huge difference, and he got better, and he flew back on his own to the European country. So he's doing well, thankfully. So that is one thing. No, COVID as an infection didn't do anything for him. He was completely negative throughout the period. We kept testing for our clinical reasons, but COVID played a huge role in producing a fresh episode of a psychotic illness, unfortunately for him. So second one is this lady is normally lives in a care home. Long history of depression and several episodes of depression in the past. But she was completely stable on treatment for whole of 17, 18, 19, 3 years. She was completely fine. Then she had COVID infection in March, but then no untoward physically for her. She made a full recovery from that. But then obviously she witnessed, unfortunately, few fellow people passing away due to COVID. So clearly it would have caused some anxiety for her. But then she suffered a major relapse with psychotic, like all the hearing voices and severe agitation and continuous shouting. So again, this is like it's not that the COVID per se caused this any sort of identifiable physical. No, not physical, like a relapse for the mental disorder, like causing delirium or any memory type problems, but it's more like a triggering a fresh severe psychotic depressive episode. And she also did well only with ECT. Okay. So yeah, this is just how it was affecting two different individuals in two different ways, this COVID actually. So I'm really stopping there, and if yeah, we can go into discussions.
Okay, lovely. So that's a very short, sharp, and sweet presentation of you both, starting from anatomy of the brain, and then functions of the brain, the pathology of the brain, the COVID effect on the pathology of the brain, and its management. Very impressed. Before starting question and answer, I just want to say our organization is called Madras State Medical Association, which was founded 35 years ago. And the members are all doctors qualified from in South India, Tamil Nadu medical universities. And then recently, in order to attract youngsters like our speakers today, we also have Tamil Nadu doctors group. So we both combined group. So that's our the group is for. And I just want to give my observation. 2 days ago, we had a lecture in MPS. We had a guy talking about tolerance. 1 second. Well, we all heard about tolerance to religion, tolerance to race, tolerance to color. But the first time, the guy was talking about tolerance to uncertainties. Tolerance to uncertainties in NHS. And he was explaining what it was. This guy worked in Nightingale Hospital and made this observation. I think one of you mentioned early testing needed for the elderly people. So, and we didn't get the test in time. And then we didn't get the mask in time for the healthcare workers. We didn't get a proper PPE. Shipload of PPE arrived from Turkey and we couldn't use it. Mismanagement. So much of uncertainties. But British people and doctors, healthcare workers, they learned how to deal with tolerance to uncertainties. We coped well, and then there you are. We have cut down the mortalities. So that's my comment about this COVID. And also, I want to say I'm very, very shocked to see a hole in the skull. Elil, really, did they make a hole in the skull for treatment?
Yes, unfortunately, yes. But scientific treatments in psychiatry nowadays are very, very scientific and very effective. So
right.
I can assure you, nothing like that is happening nowadays.
We believe just because you say that, but it's horrifying. Yeah.